Fentanyl is an opioid analgesic used in anesthesia for breakthrough cancer pain or round-the-clock pain management. In this video, let's found. What is fentanyl? What is fentanyl used for? Contraindication. What are the side effects of taking fentanyl? How does fentanyl work? How to use fentanyl? What is fentanyl? Fentanyl, also spelled fentanyl, is a highly potent synthetic piperidine opioid drug primarily used as an analgesic. Because fentanyl is 50 to 100 times more potent than morphine, its primary clinical utility is in pain management for cancer patients and those recovering from painful surgical operations. In 2019, it was the 278th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is fentanyl used for? Fentanyl intravenous or intramuscular injections are indicated for short-term analgesia during induction, maintenance, and recovery from general or regional anesthesia. These injections are also used with a neuroleptic for premedication, induction, and as an adjunct to maintenance of anesthesia. Finally, fentanyl intravenous or intramuscular injections are used with oxygen for anesthesia in high-risk patients. Fentanyl sublingual tablets, transmucosal lozenges, buccal tablets, sublingual sprays, transdermal systems, and nasal sprays are indicated for the management of breakthrough in opioid-tolerant cancer patients who require around-the-clock pain management. Contraindication. After operative interventions in the biliary tract, these may slow hepatic elimination of the drug. With respiratory depression or obstructive airway diseases, i.e., asthma, COPD, obstructive sleep apnea, obesity hypoventilation, also known as Actiq syndrome. With liver failure. Side effects. Fentanyl's most common side effects, which affect more than 10% of people, include nausea, vomiting, constipation, dry mouth, somnolence, confusion, and asthenia, weakness. Less frequently, in 3 to 10% of people, fentanyl can cause abdominal pain, headache, fatigue, anorexia and weight loss, dizziness, nervousness, anxiety, depression, flu-like symptoms, dyspepsia, indigestion, shortness of breath, hypoventilation, apnea, and urinary retention. Fentanyl use has also been associated with aphasia. Contraindication. After operative interventions in the biliary tract, these may slow hepatic elimination of the drug. With respiratory depression or obstructive airway diseases, i.e., asthma, COPD, obstructive sleep apnea, obesity hypoventilation, also known as Actiq syndrome. With liver failure. Side effects. Fentanyl's most common side effects, which affect more than 10% of people, include nausea, vomiting, constipation, dry mouth, somnolence, confusion, and asthenia, weakness. Less frequently, in 3 to 10% of people, fentanyl can cause abdominal pain, headache, fatigue, anorexia and weight loss, dizziness, nervousness, anxiety, depression, flu-like symptoms, dyspepsia, indigestion, shortness of breath, hypoventilation, apnea, and urinary retention. Fentanyl use has also been associated with aphasia. Half-life. The half-life of fentanyl is 7 hours. The half-life of fentanyl sublingual spray is 5 to 12 hours. Dose. Surgery premedication. 50 to 100 mcg/dose IM or slow 4:30 to 60 minutes prior to surgery. Adjunct to regional anesthesia, 25 to 100 mcg/dose slow 4/1 to 2 minutes general anesthesia. Minor procedures, 0.5 to 2 mcg/kg/dose 4. Major surgery, 2 to 20 mcg/kg/dose initially, 1 to 2 mcg/kg/HR maintenance infusion 4. Discontinue infusion 30 to 60 minutes prior to end of surgery. Limit total fentanyl dose to 10 to 15 mcg/kg for fast tracking and early extubation. Adjunct to general anesthesia, rarely used 20 to 50 mcg/kg/dose 4. Analgesia, off-label. Analgesia, 1 to 2 mg/kg for bolus or 25 to 100 mg/dose PRN or 1 to 2 mg/kg/HR by continuous 4 infusion or 25 to 200 mg/HR. Severe pain, 50 to 100 mg/dose 4/IM Q1-2 HRPRN. Patients with prior opioid exposure may tolerate initial doses. Patient-controlled anesthesia, PCA 10 micrograms per milliliter 4, usual concentration, 20 micrograms demand dose with 5 to 10 minute lockout time interval and base rate of less than or equal to 50 micrograms per hour. Safety advice. US FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. Dose. Surgery premedication. 50 to 100 mg/dose IM or slow for 30 to 60 minutes prior to surgery. Adjunct to regional anesthesia. 25 to 100 mg/dose slow 4 over 1 to 2 minutes general anesthesia. Minor procedures, 0.5 to 2 mg/kg/dose 4. Major surgery, 2 to 20 mg/kg/dose initially, 1 to 2 mg/kg/HR maintenance infusion 4. Discontinue infusion 30 to 60 minutes prior to end of surgery. Limit total fentanyl dose to 10 to 15 mg/kg for fast tracking and early extubation. Adjunct to general anesthesia, rarely used 20 to 50 mg/kg/dose 4. Analgesia, off-label. Analgesia, 1 to 2 mg/kg for bolus or 25 to 100 mg/dose PRN or 1 to 2 mg/kg/HR by continuous 4 infusion or 25 to 200 mg/HR. Severe pain, 50 to 100 mg/dose 4/IM Q1-2 HRPRN. Patients with prior opioid exposure may tolerate initial doses. Patient-controlled anesthesia, PCA 10 micrograms per milliliter 4, usual concentration, 20 micrograms demand dose with 5 to 10 minute lockout time interval and base rate of less than or equal to 50 micrograms per hour.